Indeed. So this is an interactive session, and we particularly like to hear from people all over the world, and that's great that we have actually wide attendance, particularly from within Africa, in Europe, and some also from North America and Latin America. Just seen Rebecca Cantor on. Lovely to see you calling in from Santiago in Chile. And also Karen Kaplan. I know that you're in New York because I recognize the picture behind you. So I wanted just to bring you up to date on what I think is happening with COVID right now. And I'm going to use the following headings. First of all, I want to talk about the pandemic. Then I want to talk about people and the pandemic. Third, I'd like to look at public health and what we've learned about the public health issues in relation to the pandemic. And there I will also cover vaccines and vaccination. Then I want to talk about the overall status of global and national and local programs to tackle the pandemic. And finally, I want to talk about politics and policies, because right now, the more we look at it, the more we see that the response to the pandemic is heavily influenced by political positions, and I'd like to focus on that as well. In terms of commenting, if you are going to comment, please make really short comments, but I'm not going to stop in the middle of talking unless something goes wrong with my system. And so we will have the commentary starting just before 1800 hours Swiss time. Everybody, I'm in Lausanne, and I'm in Lausanne for a meeting on a number of issues that are relating public sector and government. Coincidentally, I've been meeting people with major policy roles in vaccine companies, and it's been particularly helpful to hear from them about issues that they are facing. The pandemic situation. There were altogether around 530,000 reported cases in the last 24 hours. There were 8,000 people who were reported to have died of COVID in the last 24 hours. We're running, therefore, if we look at the weekly averages, at between 2.5 and 3 million cases a week. It's really important to stress to everybody here that we're not seeing a situation where the pandemic is in decline if we look at global numbers. In fact, during the last week, the case numbers in different continents have moved in different directions. And of the 6 regions of the World Health Organization, there has been a significant expansion in the number of cases in the WHO European region. There's also been an increase in the numbers of people dying in the WHO European region. Let me give you a few snapshots from Europe that might help you to see what I am talking about. Let's start with Denmark. This is a country with a well-established healthcare system, and yet Danish public health experts are saying that actually there is a real danger that many of the hospitals in Denmark are at risk of collapse, given the increase in numbers of people who need admission with COVID-19 and the approach of the winter season. So the Prime Minister has said that vaccination passports are compulsory to access public events and venues. In France last week, President Macron went on television and said not only are they going to continue with the COVID vaccine passport system, but that for over 65s, they will now need to produce evidence of a third or booster dose of authorized COVID vaccine within 6 months of their last dose, and if they can't show that, their sanitary pass, as it's called, will not be valid. In France, you need this pass to go into any building, public building. You need it to get on a train. You need it to get in a restaurant. And if you can't show your vaccination status, you have to show a recent PCR test being negative, and you have to pay for that test yourself. In Slovakia, a surge of new COVID-19 cases from the beginning of September has been reported, with new cases in the week 1st to 7th of November being the highest that have ever been reported, a 30% increase on the previous week, with numbers of deaths rising as well. In Germany, you might have heard that there is a massive increase in the number of cases and an increase in the numbers of people severely ill and dying. In short, even though vaccination is being rolled out across Europe, perhaps not as powerfully in some countries as in others, there is definitely a new surge happening throughout the continent, and that's associated with an increase in the numbers of people dying. In the UK, cases are still quite high, with approximately 40,000 being reported each day. And it divides into two groups. COVID cases reported among the young, and that's children and young adults in particular, and COVID cases being reported among older people, including people who've been vaccinated. And the numbers of cases among older people are gradually rising. Government wonders whether it is because of the protection from the vaccines that have been quite widely distributed starting to wear off, and therefore the booster program is very much being advanced with quite strong persuasion from the government. Let's move to Africa. Let's move to an island in the Indian Ocean, Mauritius. There, on the 9th of November, an announcement was made by local authorities that schools would close from 10th of November due to the current COVID-19 situation and the pressure on healthcare. Now, one might say that actually it's particularly tough for some African countries because they've got much less coverage with vaccine than some European countries. And my fellow WHO special envoys who are covering African nations are telling me it really is bad, because governments do not have access to much vaccine in many African countries. And so the situation is that when numbers of cases rise, the government exhorts people to wear face masks, to maintain physical distancing and hygiene, and do everything possible to avoid infection. But the governments in many African countries cannot ask people to stay at home and impose movement restrictions on a wide scale, because that simply creates incredible challenges in terms of poverty and hunger, and indeed might be at least as damaging, possibly more damaging than the COVID itself. It's a kind of double bind for many countries in Africa, and that is very much the case in Mauritius. Now, Mauritius has to keep its economy going, and the economy is highly dependent on tourism. So despite the fact that they're really worried about their COVID, they have decided to reopen the economy to tourists, saying, yes, you've got to be double vaccinated. But I think everybody on this briefing knows that just because you've been vaccinated, it doesn't mean that you are not able to not only be infected with the virus, but also pass it on to others. So this is really quite serious. To keep the economy going, that country, Mauritius, has to maintain its openness to tourism. But at the same time, in doing so, that means inviting people into the country who just may be bringing viral loads and viral variants that add to the problems of the nation. It's the case in many developing countries, in Pacific Islands, in Southeast Asia, in Africa and Latin America. Countries don't have the option to impose strict border controls or to ask for massive movement restrictions because of the economic consequences for their people. It's a much worse situation than many European nations who've been able to go into debt perhaps in order to maintain economic well-being of their poorer people. Let's go to Latin America. Let's go to Dominican Republic. There, numbers of people going into hospital have greatly increased in the last week or so. And with a 16% increase in cases during the last week and a similar increase in deaths, basically the country's health services are really, really overloaded. And this is another country that can't really afford to close its borders to tourists because of its dependence on tourism for income. Let's go to Southeast Asia, Vietnam, Thailand. I've talked a bit about Thailand before, but the situation in Thailand is that there has been real difficulty with high levels of COVID and the impact on the health services. But at the same time, because of the economic damage that significant restrictions on tourism and restrictions on economic activity have caused. So Thailand is also one of these countries that's having to make the delicate balance between maintaining the economy and at the same time ensuring that people's public health can be guaranteed. In all the countries in Southeast Asia, strong public health measures are being sustained. And Vietnam, actually the country has gone into lockdown. Quite a surprise to me, because for so long Vietnam's been able to manage its COVID without major movement restrictions. But on 8th of November, because the number of new weekly cases increased for the second consecutive week, 47,000 active cases in the most recent week. That's slightly over what there is in the UK, and a 48% increase week on week, with the number of new weekly deaths still high, around the 400 level, though fortunately not rising greatly. But vaccination rollout has picked up, and there's 30% vaccination coverage among the whole of the eligible population in Vietnam receiving 2 doses. And so what this is telling us is that even when you get quite high vaccination coverage, you still have major problems when these surges come, and you have to do other measures, including asking people to protect themselves and to protect others, and you have to be ready to do movement restrictions. And so that's what's been happening in Vietnam. It's what's happening in much of Eastern Europe. It's what's happening in Latin America. And it's what's happening in some places in Africa. This pandemic is not gone away. And if anybody says it's going away, and quite often, for example, in the British media, you read commentaries saying it's disappearing, I'm telling you it's not. And not only that, there is a real anxiety among many public health professionals all over the world that now, nearly 2 years into the pandemic, it gets really hard to persuade people to continue treating the virus with respect, to continue using face masks, to continue practicing physical distancing so you don't inhale the air exhaled by others, and to continue practicing good hygiene too. So everybody, just get that message across everywhere. Relying just on vaccination, even when you've got relatively high vaccination coverage, it's not enough. Ireland, I was talking to the Irish government and media last week. They've got high vaccination coverage, up in the 80%, but they've still got rising numbers. And so I've said to them, don't just rely on vaccination. it's vaccination plus, and use the other measures. In the British media last week, I made the same comment. And so I come to my second point. People are the solution to this pandemic. They're not a problem, they're the solution. That's what we feel for all infectious diseases, that having the people as part of the response is key. And that means levelling with the people on what is really happening. Levelling with people that this is a dangerous virus. Levelling with people that this virus has absolutely not gone away. Levelling with people that this virus is mutating. Levelling with people that they need to take it seriously. Levelling with people that, yes, if a vaccine is available, please get vaccinated. Not so much for yourself, but also to contribute to the protection of others. Let's everybody, all of us, just practice in our lives the reality that people are the solution. Thirdly, we can't deal with COVID without good quality public health services. What do we require of public health services? The ability to enable any individual who wishes to be tested to find out their COVID status. The ability to enable people to isolate if they're positive, because that's the way in which you break transmission and stop this disease from spreading. The ability to trace the contacts of people who are positive, or even those who are suspected of being positive, and to isolate them as well. The ability for people to be isolated without them being stigmatized, without them having to shell out loads of money. And the ability to protect people who are vulnerable, who are immunocompromised, who've got respiratory challenges, who've got diabetes, who have got other diseases that put them at risk. Now that is what good public health is all about. I want to ask all of you, please make certain that you are advocates for good public health and that you're advocates for testing to be available. Please join me and others in campaigning for better access to quick tests that are reliable, that can be done without the need for electricity or even expensive laboratory services, and that can be done by individuals everywhere, ideally with the help of a trained professional. Let's put a lot of emphasis on better swabbing techniques so that actually everybody can learn how to swab and swab well, because so often the swabbing isn't good enough. Everybody here knows it's not an easy thing to swab inside the nose both sides and to go deep enough. It makes you feel uncomfortable. So let's help everyone to learn the swabbing. And let's encourage the drug companies and others to invest in the manufacture of really reliable rapid tests so that we don't have to rely on PCR. If as much resources had been put into diagnostic tests as into vaccines, we would have got much, much further. And it's diagnosis that's best for poor countries. And when it comes to treatments, everybody, let's make sure that the treatments are available at a low cost and that we're not charging people huge prices for effective treatments, as is happening right now. Public health really matters. And public health includes protecting health workers. Numbers are not clear, but at least 100,000 health workers appear to have died of COVID. I mean, that's terrible. And we still don't have enough vaccine in poor countries to enable all health workers to be protected. That's terrible. So we need to really take health workers seriously as part of the public health response. And let's do everything we can to avoid the deliberate spread of misinformation about COVID. It's not acceptable that people should be told all sorts of untruths about what vaccines done. Let's do our best to counter it. It doesn't mean we ridicule or vilify those who spread misinformation, but we do everything we can to stop the deliberate spread of misinformation in order to try to undermine the response. Let's talk about programs, my fourth point. Well, continent by continent, there's a lot of coordination across Africa with support from the African Centres for Disease Control, African Union and others. There's a lot of coordination in Asia. There's a lot of coordination in Latin America and the Caribbean and the Pacific. And that's the way you deal with this. But the coordination in Europe and North America is not so good. Coordination across the states of the US, frankly, is very disappointing, with different states having different approaches that have nothing to do with the epidemiology. And in Europe, we still see competition right through the continent of Europe and beyond, much to the frustration of the WHO and particularly the European Regional Director. You don't deal with a pandemic effectively if you have uncoordinated and disunited responses. Now that brings me to my fifth point. The politics are really not good at the moment. There is most definitely, in many countries, a split. People on the left-hand end of the political spectrum recognise that there is a role for governments in helping individuals to decide how best to deal with this pandemic. People on the right-hand end of the political spectrum increasingly see the role of government trying to support the public response as interference and actually actively work against it, sometimes taking legal cases against their governments, especially when mandates for masking or even mandates for vaccination are introduced. This politicisation is really unfortunate. It did happen with Spanish flu in 1918. It did happen with bird flu in 2005. It did happen with the pandemic of influenza in 2009. But all our experience is that to politicise the response to a virus is really unfair to people. It's not taking people seriously. It's not taking public health advice seriously. And I really would like any advice that any of you can give on what people like me can do to try to counter this politicisation. So those were my 5 headings, and many of you are familiar with what I'm saying, but I'm slightly pushing towards a stronger approach on politicisation, a stronger approach on examples being set by political leaders, particularly on masking, because this pandemic hasn't gone away, and everything I see tells me it is really hurting poor people. Pandemic, people as a response, public health is essential. Programs that link together different countries are the right way to go. And politicisation of the pandemic and its response is really not working in the interests of people anywhere. Thank you. Catherine, please, for the half-time.
Thanks, David. As always, stimulating, super interesting, and you can tell from the chat that there is no lack of interest in all the comments. I wonder if I might call in Raquel just for a second to show us her beautiful illustration. Sorry, Raquel. No. All right. Well, we will call in Raquel later in the hour and see if we can. Oh, hi, Raquel.
I'm here. Yeah, I don't know if I can share it myself. I don't know.
I think you probably have screen share capacity, but let's find out. Oh,
okay.
Beautiful. Thanks so much. Is there a favorite part of this for you?
Say again, sorry.
Do you have a part of this that's particularly interesting to you?
Oh, I think everything is quite interesting, but I think politicization is going to be probably a subject that I'm not very familiar to, although we all know, but we need to know how far it is in real. And then the people, obviously, which I think is a main part of this, because we need the people to collaborate with this. And yeah, basically to know that the pandemic is far to be over.
No, I
But yeah, looking forward for the rest because it's really interesting. I think it's going to give me it's going to give us a whole perspective, a whole picture.
I think that's fantastic. I like that segue. I'm looking forward to the rest myself. So, and I agree, politicization is one of the biggest and most interesting questions in this whole process. David, we have a heap of interesting comments. I've already sent you text messages.
Thank you.
So maybe I'll hand back to you because I don't want to waste any time on me
Thank
when
you.
we could be listening to you speaking with people.
Good, thank you. And I've not got a text. I've got one text, but if there's more, please let me know. Everybody, if you want to speak, just make sure that it's in the that Catherine knows. Thank you very much indeed. There we go. Now, I want to say how delighted I am to see that Dr. Rajanarasan is here on with us. Thank you for. And there you are. I can see you, and it's dark where you are. And also, I'm not sure whether you're comfortable speaking in English or in French or what, but it'd be lovely to welcome you and to thank you for joining, former Minister of Health of Madagascar. I'd be very, very interested to know how you react to anything I've said. You have the floor, sir.
Thank you for giving the opportunity to speak. But I think it's more interesting if I can speak in French. Could I speak in French? Or
Oui,
to speak
c'est
in
vraiment
English?
possible de parler en français. Peut-être un peu courte, s'il vous plaît, parce qu'on a beaucoup de gens, mais pour 2-3 minutes en français, et je vais traduire. OK.
Merci de me donner la parole. Concernant cette épidémie, cette pandémie de Covid à Madagascar, on constate que le nombre de vaccins qui arrivent est très, très insuffisant par rapport à la population. Nous sommes une population de 26 millions. Bien sûr, 80% de la population se trouve en milieu rural, mais les 20% dans le milieu urbain ne peuvent pas avoir de vaccination. Car jusqu'à maintenant, au jour où on parle, il n'y a que moins de 2% de la population qui est vaccinée. C'est-à-dire sur les 23 millions, 26 millions, c'est très, très peu. Or, comme vous avez dit, la relance économique pour les pays en Afrique, en particulier pour les îles comme Maurice ou Madagascar, la relance économique doit passer par le tourisme. Car le tourisme va faire son plein pour ces populations qui ne sont pas vaccinées, et en particulier dans les milieux ruraux où les touristes vont voir, parce que les touristes ne vont pas rester à la capitale ou dans les grandes villes. Ils vont aller dans les milieux ruraux où aucune vaccination n'est au programme jusqu'à ce jour. Pour le problème du nombre de vaccins et surtout pour le problème du logistique des vaccins. Parce que c'est un pays qui est grand, avec des infrastructures quand même, et une logistique très, très faible.
Merci.
Donc, si on veut vraiment faire une approche logique, il faut essayer de voir, donc les pays du Nord doivent penser comment aider rapidement, très rapidement, les pays du Sud pour que ce taux de vaccination puisse se maintenir à un niveau acceptable. Je vous remercie de m'avoir donné la parole.
Merci, Dr. Rajanarasan. I will translate what His Excellency, the former Health Minister of Madagascar, just said.
un former health,
Pardon?
un ancien ministre de la Santé. J'étais un ancien
Former Health Minister. Yeah, so sorry. Madagascar has a population of about 26 million of people who are eligible for vaccination. 2% of the population has been vaccinated. They have to stay open to tourists because the economy depends on it. The tourists don't stay just in the capital, Antananarivo. They travel around. It's a beautiful country. Some of the most wonderful, wonderful wildlife and scenery in the world. But the people in the places where the tourists are going to go to will not be vaccinated. So they will be at risk of being infected by the tourists, even if the tourists are double vaccinated, because vaccination doesn't prevent you from carrying the disease. And in addition, getting more people vaccinated in Madagascar is really difficult. The logistics, particularly the cold chain and the health system, in the words of the doctor, they're quite feeble. So he says, it is absolutely essential that the wealthy nations of the world move rapidly to increase access to vaccine in poor nations, and also to support the effort to immunize the population. It's as clear as that, everybody. That's the story. And the doctor said, it's not just in Madagascar, it's in many other countries. So everybody, I'm going to now move on to others. Merci beaucoup, Monsieur le ancien ministre de Santé. J'espère que c'est OK si je donne la parole à autres. J'espère que j'ai bon traduit vos mots, mais si vous avez autre petite chose à dire, je voudrais redonner la parole à vous. Okay, everybody, let's move on. And here I would very, very much like to hear from others who are able to tell us what's happening in their parts of the world. Now, I'd like to still work with people who are in low-income countries. Magen Murtefa in Gaborone, can you hear me? Would you like to come in?
Yes, I can, David. How are you? My network is poor, so I'll just speak because it's cutting. Can you hear me?
Yes, just hear you. Yes, yes, yes. Thank you.
Okay. Yeah, our numbers are quite low now. I think we have about 1,234 active cases. And vaccination has risen a bit. We about 30-something% have been vaccinated, and things have gone back to normal. People are now expected to go to work. There isn't any working from home anymore. However, people are still expected to wear masks, but people are now going out for gigs. There are now huge gatherings. Life is just as normal, and I don't know how this works, because when people meet and gather, they take off their masks and they have fun, drink and whatever. But then as soon as you get out, you wear your mask. So I don't know how that help is going to help us. But that's the situation right now. I can just say things have gone back to normal, except that people are still masking, but then The sanitizing standards have gone down. People sanitize when they feel like. There are no sanitizers everywhere anymore, so people are relaxed.
Can I just say to everybody, now Megan is describing a really difficult situation. In Botswana, they've managed to really push up the vaccination coverage, but now, with the numbers dropping, people have stopped wearing face masks and practicing physical distancing, particularly when they are close together and particularly in social events. This is really, really dangerous from a public health perspective. So what we need to do is to be thinking, how can we enable the public to continue practicing prevention when the numbers are coming down? Any one of you who have done communicable disease control know that the dangerous time is when the numbers are coming down. And so we have got a major, major communications challenge here. And it's particularly difficult if the leaders don't set the right example, as we have seen from certain countries, even during the COP26 climate event in Glasgow. There's a famous picture of not every leader wearing a mask when sitting together. Bad example. So Megan's point is we've got to keep everybody following the preventive procedures even when the numbers are coming down. Thank you very much, Megan. Iman Ahmed, come in, please. You have the floor.
Hi, David and everyone. Thank you very much for the opportunity. I would like to speak about Sudan, and I will make it very concise and direct. On October 25th, a military coup happened in Sudan. People are out in the streets protesting in millions, and that is huge mass gatherings. The coup d'etat leaders have basically removed most of the public health leadership in the Ministry of Health. So health service provision and the health system overall is crippled. Doctors are on strike, but they are providing emergency services. We are gravely concerned about the mass gatherings and now the various organizations of doctors inside Sudan and outside. We're trying to issue guidelines to the people to observe physical distancing and all of the COVID-19 guidance. However, we know that the cases are rising. Some people who have been detained and put in custody without trial, they themselves are infected with COVID. The Minister of Health is not able to conduct his day-to-day duties. Most of the capable and well-qualified health cadres in various ministries at central level, at the federal level, and in the provinces have been either removed from their positions or are being threatened on a daily basis. One of the most serious issues is the pre-positioning of supplies. We are not able to do that. The WHO has provided health kits, emergency health kits, trauma kits, surgical kits, WHO, ICRC, MSF, and we are working with these partners. But the coup authorities and with their allied health forces are even preventing that pre-positioning. It's becoming very difficult day to day. Like there was a march on October 30th, and we were able to address that in terms of pre-positioning. But as of today, tomorrow, the 13th of November, will be a major march in millions around the Sudan and in multiple cities around the world in support of the people of Sudan against the coup. Those inside the country are going to face problems because of the difficulty in pre-positioning supplies. The internet has been cut down and telecommunications. So this is a state of total isolation, mass gatherings, and health personnel being removed from their positions. Minister of Health not able to conduct his duties. We're not even able to know the actual numbers of cases of COVID-19, let alone address them. And the isolation centers that were functioning before are now crippled and in a state of just totally non-functional. Thank you, Wolf.
Iman, thank you. I'm thought of you when I heard about the coup. I'm really sorry. And in other countries where there have been coups recently, we have heard of similar difficulties. The ministers and officials in the health ministries removed from their positions, and any discipline that there has been goes, and it's really, really difficult for the people. Iman, all I can do is say this is tragic, and it is absolutely essential we keep talking about it. Let me just invite one or two people to make very quick comments if they want to. Carol Prezone, please.
Yeah, Catherine asked me if I could speak about Mauritius, but I can't really. The only reason I put that on the chat is it turned out it was one of the only places my son and his girlfriend, who spent 9 months separated, could be together, because like many countries desperate to reignite tourism, they're handing out long-term free visas to digital nomads. But of course, actually the Mauritius vaccination rates are relatively good, but you're still going to get an influx of many young, healthy, vaccinated people potentially carrying COVID, like the former minister said, to remote areas of an island where people might be much more vulnerable.
We really need to keep this point very, very strongly said, that countries have to open up to tourism for economic reasons. It does endanger the local population. There's a huge, huge responsibility on tourists to act with massive responsibility. Thank you. Now, Catherine Bond asked about Molnupiravir, which is a Merck pill that's advertised in the media as a drug that actually forces the coronavirus to mutate itself to death. Data has still been collected on this and also on a Pfizer drug that's been developed. I cannot tell you how useful these new medications are going to be. I'm optimistic that they will make a big difference, but they've got to be available at really low cost. It's the same as what happened when we were seeing the development of medicines that could treat people who'd got HIV. At the beginning, they were incredibly expensive. And so it's super important that we have pressure on the companies to make sure that they can make them available in large quantities at a much, much lower rate in poor countries. My information is that Merck are going to try and do this, but it needs a very close watch to make sure it really happens. Dave Harron. Dave, did you want to just speak for a couple of minutes? Are you in Liverpool? You're muted. Well, I'll tell you what Dave Harron said.
There we go.
Here you are.
Am I on?
Yeah, a couple of minutes. Yeah.
Couple of minutes, right. I've just heard a very sad story from Sudan. I spent over 4 years, several sessions, several months teaching public health out there. And it just destroys me to find out that it's all gone down the drain. The other point I would ask is, has the emphasis that we've been placing so much over this last year on vaccination actually deflected us from the other public health protective measures? It seems to me that that's what's happened in England, and it's probably happening a lot over various parts of Europe.
Dave, you're so right. The WHO motto is do it all. Don't rely on one intervention. And certainly we look at the UK situation with absolute trepidation. Super reliant on vaccination, now reliant on booster vaccinations. and it's a real problem because as the protection diminishes, and it does so at varying rates in different people, then susceptibility increases, and then if they're not using other techniques like mask wearing, like physical distancing, then it just puts people at terrible risk. And in addition, there are big worries about the variants and the possibility that new variants will come along and be able to dodge the protection of the vaccine. I'm due to take part in an event at quite high level in the UK next week, where I shall make exactly that point. And I shall have your comments, just that you've said just now, ringing in my ears. Now, there's a person who's got on their screen RFA 86, and I'll just read to you what the message is. What I see from African people is that they are sceptical about the efficiency of vaccination. In addition, we cannot forget the fact that the virus is not spreading in warm places. So most people living in the warmer countries should really have a good chance not to be infected. I just want to say, everybody, right now there is no evidence that this virus is more easily transmitted in cold settings than in warm settings. It seems to be transmissible in warm settings. However, when the weather is cold, people are more likely to be close together. When the weather is cold, people are more likely to be in non-ventilated locations. So there may be a higher incidence when the weather is cold, but it's not to do with the virus, it's to do with people's behaviour. In addition, in cold weather, in, for example, Europe, there are other viruses that are around that cause other respiratory infections, and that leads to real overloading of health service. And so in the UK, there are worries about the influenza that will come up in the winter. And then for children, there are worries about respiratory syncytial virus causing problems. I hope that's clear. Now, Karen Kaplan, calling in from New York. Quick comment from you, please.
Okay, unmuted. Hello. A quick comment on political will.
Shout loud because I can't hear so well, please.
Okay, sorry. Let me turn this up. Is that better? Okay. A few years ago, I worked on the launch of a presidential campaign for Africa for UHC. And I just, my 2 cents now would be to say, I think that the ministerial level is where it's at. They all run their own feet, it's the ministers of health and finance, and then all the local ministers who run fiefdoms. They truly do. And one of the things, because I come from the fundraising angle for it, and presidents who want to get involved in UHC in Africa and fly around, they have a contingent of 24 people who need to fly first class. It's a $25 million campaign per president who wants to get involved. It's not a financially feasible way to actually move the line for UHC and the triple billion. So I feel like if you just go to actually the people who make the decisions, who really actually have a tremendous influence on the presidents, it's the ministers of health and finance, and then what flows beneath them. And I think you can do an actually targeted campaign that is very inexpensive to do and to reach them where they live and speak, where they will feel respected. And that's all I have to say.
So, Karen, thank you. I'm hoping that I will have an opportunity to speak with some of those who are involved in a ministers of finance and ministers of health track of work on infectious diseases in preparation for the G20 in Indonesia next year. And I will have your words ringing in my ears. Thank you very much indeed. You're so right. The ministers of finance can have a great deal of influence on the behaviour of ministers of health. Ministers of finance have not got the reserves in their national treasuries to be able to deal with the consequences of perhaps less responsible than it should be behaviour by the ministers of health. Thank you very much indeed. Sarah Phillips, would you like to come in?
Hi there. Really a comment on masks again and what's going on with us without getting too political. But when we've got this leadership that just, we're not being led towards using masks, we can see it everywhere. And there's some comments in the chat about it that it's noted that the UK has got very low mask usage, but I have noticed a difference in the people leading that. So people that are listening to reality and are listening to science are taking it up, and you see them in the shops now, and you see this sort of thing. So that's making me feel a little bit better. But yeah, it's quite frustrating, and it's quite frustrating here. Thank you.
John Atkinson is both a colleague and also a regular watcher of what's happening in the UK, based in Rugby. John, please.
Yeah, so I'll sort of pick up on that, but link it to something Chris Langdon put right early on in the chat, which is saying, well, how do we get our message across about the complex interlinkages between everything that's going on, between food and climate and the inequality of it all? And it links, I think, to this political process, and it links a little bit to what we're hearing about masks. There's a tendency for professionals to talk about data, to provide numbers, to provide graphs, whereas politicians tend to talk in stories. And somehow I think we need to find stories that are compelling, stories that make sense of the data for people, stories that touch people's hearts and touch their emotion. Because if we do that, people do change what they do. We've seen it throughout this. But if we stick just saying, no, it makes more sense because, we're forever trying to catch up with something that's really caught people in a way that the information of itself, the data hasn't been able to. So tell good stories that make sense of what's going on.
Stories that touch the heart. Thank you, John. Now, Jane Lawless is playing a major role in New Zealand's work to deal with COVID. And we are so impressed by how New Zealand has responded. We know that it's a bit tough at the moment. Jane, you have the floor.
Thanks, David. Yes, I'm just arrived back in Switzerland after 14 months in New Zealand. So just back in Europe. It's been very interesting. New Zealand's just now pivoting from the elimination strategy to the suppression strategy because Delta basically overwhelmed every defense we could throw at it, and we didn't have anything more to offer. We've been preparing our population and systems for this transition, but it's a shock for New Zealanders because they haven't had to experience COVID in the community, and it remains to be seen how we go. There's been a really heroic effort with vaccination, and some of our regions are now over 90% with the over 12s. It's also been interesting that the rate of infection is not rising as quickly as one might expect. And listening today, one has to wonder if the fact that there's a lot of social control still on is playing a part as well. I've been shocked to come to Switzerland and see how little mask wearing and social distancing is happening despite the rates. And I've come from New Zealand where I was living in the capital city with no known COVID, and most people are wearing masks outdoors, socially distancing. We're working from home, and it remains to be seen how New Zealand goes. But it is interesting that the range of social controls that the range of controls you're talking about are in place. And so far, we're not seeing the acceleration that we might have expected. So early days, but yeah, very interesting contrast to be back over this side of the world. Thanks, David.
Thank you. Well, welcome back to Europe, but how fortunate that you're able to bring with us your own experience. I mean, New Zealand is doing so well, everybody. They have really taken the preventive approach seriously. The public are fully engaged, and their incidence figures are really relatively low compared with the kind of incidence we saw in some European countries where no prevention was done. It brings me back to my basic point. You need to do the preventive work as well as vaccination. If you just do vaccination alone, it's really dangerous. Now, if Claire Rayner is here, we're reaching the end. Just a word or two from Claire Rayner. I have to come to you because you have been a person, one of the people, Paul Garner's gone unfortunately, but he's the second, who really have got me focused on long COVID. What on earth is happening in the UK? There must be masses of long COVID with this let it all go approach among young people that we've seen. Over to you, Claire.
Yes, there is. And one or two extremely worrying things. There appears to be some very late onset myocarditis. So we've only got 18 months data to look at, but the cardiologists, they are seeing heart damage, new heart damage, even this far along. The other thing that's even more worrying is that people with long COVID are being found to have multiple blood clots. And these are people that were not treated in hospitals. So I know doctors who are literally riddled with them from the original infection. There are people who have never recovered from the first virus and we're talking young people as well, 16, 17-year-olds, infected a second time. Goodness knows what the impact on those is going to be with the second infection on top of ill health. Worries me extremely what's happening in children. The policy has been let it rip in children. And I think that's immoral, as do many people here. I dread to think what the impact is going to be on cognition long term. We have a health minister who is a former finance minister. So we've got him, the finance minister, who think that vaccination is the only thing. I think we've all got, those of us who are very vocal have become even more vocal, and we're now using a lot of direct questioning to the health ministers online and on Twitter saying, so what are you doing? Now, whether this is going to work or not, but all else has failed. So they are being bombarded with daily questions.
Thank you, Claire. Thank you, Claire. Thank you, Claire. I hear it a little bit in your voice. We have to reach the end now. Look, here is my request to all of you. 1, keep remembering that COVID has not gone. And to Rebecca and John Luke, the WHO do not want to say it's gone endemic because they're worried that that will lead people to just simply say, we've got to let it go. And the WHO line is to say, no, you don't let it go. So it's here and it's staying, but it comes in outbreaks that are surges. And what needs to be done is the preventive work must be maintained. And it's do it all. It's the personal prevention. As we heard from Jane Lawless, it's working really well in New Zealand. It's the public health, picking up people with the disease with good diagnostics and enabling people to isolate without it costing them a lot of money. And then it's the vaccination, and the vaccination primarily to protect people. Remember long COVID. There is one person I know on this call who is experiencing long COVID, and I have seen how it's affected her firsthand. It really is desperate for people. And as Claire has just said, it goes on. And there are symptoms that are real. I hate that term. There are symptoms that are based on pathology, and that means it needs attention. So hold on to that, everybody. This is a disease that is long, and it affects between 1 in 10 to 1 in 20. There's not a nice, cheap, inexpensive treatment drug. There are drugs appearing, as we heard in the discussion with Catherine, following Catherine Bond's comment. But they're not yet there. We must get vaccine equity. This inequity with rich countries having 5 times as much vaccine in store as they need and then letting it go off, that's just not acceptable. As we heard from Dr. Rajanarasan, we've got to get the vaccination right. Remind everybody even if they're vaccinated, if they're traveling around and they've gone from a high prevalent, high instance country, that they must be careful not to be taking vaccine into populations that are completely susceptible. They could provoke major outbreaks. That would be terrible. It's important that we work together and we don't politicize this. We're 2 years in, it's still very much here. We must all be dealing with it based on the epidemiology and what we know about how to respond. We should not have it treated differently depending on what political party is in power. We must continue to speak. We must continue to say what we believe to be right. We must continue to work for the people who are most at risk. Remember, for wealthy people, this can be managed. They can work from home. They can organise all sorts of support. For poor people, this is a horrible, horrible problem. Thank you for being with us today. Thank you everybody for the support. Thank you team for what you've done. Back to Catherine for the last bit.
Just a quick shout out to Raquel. If you have a second to show us your illustration, we'd be super grateful.
Let's see if I can now, because I'm not sure how I did it before. Okay.
So David, I feel like this drawing reflects your incredible call to action that we just heard. Raquel, and you?
So I think it's been quite clear, the message, which is basically that we cannot relax about this situation, and we need to work all together, and that we basically need to, I think the preventive approach, I would say, is the most important thing. And for that, we need the collective contribution. Basically, we can't, it has to be something that we do all together. But I think that's, for me, the most important message is more preventive than doing after.
I think that's a super great message to end on.
COVID on there. Can I see it? I'm looking.
Yes. It's on the left-hand corner there, David, the COVID with the teeth.
Oh, there are two, one in the left and one in the right next to the end, but it's going to be another one that is going to be added now. So there will be 3 COVIDs.
I'm fond of the one with the teeth. I think that's my favorite at the moment.
Yeah, there's another one on the right side.
So David, I think the idea that prevention is what we should take home. It also resonates with the message from the European region recently that we need to shift our thinking from responding to outbreaks to really preventing them from beginning at the beginning to start at the beginning. And which is exactly what you've been saying all along. So I just want to say thank you to everybody. David, I'll hand back to you for a quick goodbye, but everybody have a great Friday, have a great weekend. We'll see you in 2 weeks. Thanks again to Live Illustration. We'll make sure that the link to the video on YouTube and in our website is available to all. Raquel, fabulous illustration. David,
thank you very much, guys.
So I